In this video, we will talk about the Elon Musk Neuralink approved by FDA. Before we dive deep into it, just support us by giving a thumbs up on this video. Let's begin. In 2016, Elon Musk and a founding team consisting of 7 scientists and engineers established Neuralink as a company. Experts in several fields, including neuroscience, biochemistry, and robotics, were among the first appointments made by the company. In January of 2017, the trademark Neuralink was purchased from the former proprietors from whom it had been licensed. Very next year, in 2017, Neuralink made the announcement that the company's short-term goal was to manufacture devices to treat significant brain illnesses, and that the company's long-term goal was human enhancement, which is also referred to as transhumanism. Musk had stated that the science fiction concept of neural lace in the fictional setting of Ian M. Banks' 10-book series, The Culture, was partially responsible for his interest in the subject. Musk described the neural lace as a digital layer above the cortex that would ideally be implanted by a vein or artery rather than requiring significant surgical insertion. However, this does not necessarily rule out the possibility of major surgical insertion. He stated that the long-term objective is to achieve symbiosis with artificial intelligence, which he views as an existential threat to humanity if it is allowed to go unchecked. He also added that the long-term goal is to achieve symbiosis with artificial intelligence. He believes that the gadget will be something analogous to a video game, like a save game situation, where you are able to resume and upload your last state, and that it will address brain injuries or spinal injuries and make up for whatever lost capacity somebody has with a chip. Neuralink stated in a tweet on Thursday that the FDA approval represents an important first step that will one day allow our technology to help many people, but the company did not disclose any other information regarding the upcoming research project. In addition, it stated that it is not actively recruiting participants for the experiment at this time and that additional information would be made available soon. The Food and Drug Administration (FDA) issued a statement in which it admitted that it had given Neuralink permission to use its brain implant and surgical robot for trials on patients, but failed to release any other information. Reuters reached out to both Neuralink and Musk for comment, but neither party responded. The significant achievement takes place at a time when Neuralink is under investigation by the federal government as a result of allegations by Reuters concerning the company's work with animals. Employees at Neuralink have reported to Reuters that the company was hurrying and botching surgery on monkeys, pigs, and sheep in order to get FDA permission, which resulted in the deaths of more animals than was strictly necessary, according to the employees. According to the sources, the animal tests resulted in the production of data that was intended to assist the company's application for human trials. In one occasion in 2021, the corporation implanted the wrong-sized implants into 25 of the total 60 pigs it was working with. In the end, all of the pigs were slaughtered, which was an error that, according to the workers, could have been easily avoided with greater preparation. After Reuters published an article about potential financial conflicts among members of a panel that oversaw animal testing at Neuralink, lawmakers in the United States called on regulators to conduct an investigation into whether the composition of the panel contributed to failed and rushed studies. In a second investigation, the Department of Transportation is looking into whether Neuralink illegally carried harmful infections on chips taken from monkey brains without taking the appropriate precautions to confine them. Neuralink is also the subject of an investigation by the Office of Inspector General of the United States Department of Agriculture for suspected violations of animal welfare regulations. Within the scope of this investigation, the oversight of Neuralink by the USDA has been analyzed. The investigation was started because there was rising worry among employees that the corporation was hurrying research, which was inflicting further pain and leading to the deaths of monkeys, pigs, and sheep. There were several attempts for Musk and Neuralink to comment on the reports from Reuters, but neither company ever answered. According to data kept by the FDA and statements made by an employee of Neuralink, the FDA had not conducted an inspection of the company's laboratory procedures as of a few weeks ago. According to Victor Krothamer, an adjunct professor of biomedical engineering who worked for the FDA for 3 decades, including a stint overseeing the office that reviews humantrial requests for brain implants, the FDA does not typically inspect facilities as part of their review of applications for clinical trials. Krothamer was in charge of the office that reviews humantrial requests for brain implants. But he said that despite the concerns raised about Neuralink's animal trials, this would have been appropriate in this particular scenario. Musk used the analogy of a Fitbit in your skull when describing their product at a live demonstration in August of 2020. These claims have been called into question by a number of neuroscientists as well as publications. According to an article published in MIT Technology Review, the demonstration's primary purpose was to stir excitement. The article also stated that Neuralink has provided no evidence that it can or has even tried to treat depression, insomnia, or a dozen other diseases that Musk mentioned in a slide. The lecture was also remarked on by Andrew Jackson, who is a professor of brain interfaces at Newcastle University. Jackson responded to Musk's claim that he regarded the gains made by Neuralink to be profound by saying, "I don't think there was anything innovative in the presentation." Thiago Arzua, a researcher at the Medical College of Wisconsin, said that Neuralink's capabilities are not very innovative and that the concepts behind a brain-machine interface BMI date back at least 50 years. He mentioned the example of a man who was able to successfully manipulate a robotic prosthetic limb that provided him with haptic input. The man utilized this arm in 2016 to give President Obama a fist bump. According to Arzua, the presentation given by 2020 Neuralink showed little more than a flashy new design for a BMI with more electrodes. A recording system with 1536 channels was made possible thanks to the development of an application-specific integrated circuit ASIC by Neuralink. This system is made up of 256 amplifiers, also known as analog pixels, that are capable of being individually programmed analog-to-digital converters, also known as ADCs, that are contained within the chip, and a peripheral circuit control that is used to serialize the digitized information that is collected. It seeks to develop a greater knowledge of brain function and the ability to activate these neurons back by converting information obtained from neurons into a comprehensible binary code. If the testing on animals is unreliable, the permission for the human trials may be dependent on inaccurate data regarding the safety of animals. According to Crothamer, the FDA ought to have verified their trust in the findings of animal studies. According to a report, Neuralink had intended to obtain approval to implant their technology in 10 people before the project was canceled. According to current and former employees, the company has recently been in negotiations with the government to reduce the number of patients it is testing, since the agency has raised safety concerns. There is no way to determine the total number of patients the FDA approved in the end. Musk believes that the implantation of computer chips in the brain could one day treat a variety of illnesses, including as obesity, autism, depression, and schizophrenia, in addition to enabling web browsing and telepathy. Late in the previous year, he made news when he stated that he had such complete faith in the security of the devices that he would be willing to implant them in his own children. At least 4 times since the beginning of 2019, Musk has expressed confidence that Neuralink will soon begin testing on humans. However, the corporation didn't apply for FDA permission until the beginning of 2022, and Reuters reported in March that the government turned down their application. The FDA had expressed various safety concerns to Neuralink that needed to be resolved before the company could move on with human testing. Some of the problems that arose with the device included its lithium battery, the chance that the wires of the implant may migrate within the brain, and the difficulty of properly removing the device without causing damage to the brain tissue. That's enough for today. If you want to watch more crazy stuff like this, subscribe to our channel. You have a great day ahead.